Good morning, ladies and gentlemen. My name is Dr. Maximo Gomez Nacer, and I am looking for a job in the medical field, either as a postgraduate residency training or a other facility that would be even a management position in any of the medical venues that we have. Now, let me talk a little bit about myself. My background is medicine, general practitioner first, and then in 1998 I was selected to one of the research program at Columbia University. So I was 4 years there at the project of NOMAS and Northern Manhattan Stroke Study and the Information for Diabetes Education and Telemedicine. Now, in 2002, I was one of the doctors selected to do the training. In July 1st, President George W. Bush pronounced an important speech called the Speech of the Compassionate Agenda, and I'm one of the many doctors that is appointed to or selected to actually do this training. My first rotation was in the floors of internal medicine. This is Lincoln Medical and Mental Health Center in the Bronx. And so if you want references, one of my first professor in that was Dr. Kana. He is a doctor from India. He's still a doctor there at Lincoln Medical and Mental Health Center. My first rotation was with a couple of doctors from India, Dr. Anita Alvarez and Dr. Nara Mukam. He's, I believe, right now in India, but he's a wonderful, excellent doctor. And so this is the first rotation. This is July 2002. By August, I do the rotation with a doctor called Abdul Mondul from Colombia. He is like the professor, the person in charge there. The doctors that work with me at this point are Dr. Sarah Muhammadi from the Middle East, as well as Dr. Jay is in first year, Dr. Swati Joglekar. She's working somewhere in Texas now. Now, for the month of September 2002, I will work with Dr. Garg, and the doctors are first year also doing this residency. I'm doing psychiatry, they're internal medicine, but we share the floor. We're doing these rotations all in internal medicine, 8B and 8C, the floors in the hospital. So Dr. Achilles Litao and also Dr. Deborah Chang, also Dean Chang are the doctors. And then in October 2002, I do this rotation with another professor, Dr. Daniels, and then I believe there are other doctors, Dr. Kumar, Dr. Jabarek, Dr. Kasubai, some of the doctors that directly or indirectly can work with. And then the doctors in the first year were a doctor from Colombia called Camilo Rincon, doctor from, let's say, from the Middle East, Ruba Barakat, her husband, Jamil Meluelain. Also, they are actually working south, I believe, also in Louisiana or Texas region now. Of course, they have interaction with many doctors. My ex-wife at this point was a resident at the same program, so I was familiar with Lincoln Center from 1998. So I had some outdoor activities sharing with all the residents and many of the attendings at that point. Dr. Anita Soni is the chief of the department, is the boss there. So from that time, I already know Dr. Esbarur Jacob Jobson is a doctor from Ireland, and Dr. Esquivel, who is also also an attending still today there, Dr. Velasco, a doctor, I believe, from Peru. He was also one of the doctors there. Dr. De Souza, which became the chief resident during the year when I am practicing. Excellent doctor, wonderful, from India as well. And then in this process, of course, interact with many doctors from all around. This is the equivalent, the United Nations medicine, because this is New York, and this is New York City Health and Hospital Corporation. So from Russia, for example, Lisina Gilina, I believe her name, Dr. From the Middle East, Dr. Binokar, I'm sorry, from the Eastern Europe, Binokar, Dr. Sikora, and Dr. Sonia Chawla, she is from India, Dr. Ottavia Balan, also she is one of the countries from the east of Europe. Let's say, thinking some of the other doctors, Dr. Said from Israel, Dr. Levon, I think he's also from Israel. It's an interaction, it's a team. I am assigned to one of the places, to the housing, lately is in 1918, I believe, of First Avenue, just across the Metropolitan Hospital in New York. So we developed a camaraderie relationship. We had to travel back and forth to the Bronx. We have to go together in many ways. We share the transport. So we participate in all the activities, and this is real. So then I am assigned to several patients, and this is they started from the time ago into July. Let's say from July to October. Let me describe with you some of the cases that I believe are totally wrong and we have to improve. One of my patients was exposed to progressive amputation of the toes. And there is a problem that they are not giving me enough communication. As a matter of fact, it looks like there is a disconnect between the continuation of care. The patient comes from the ER, they don't give me information to me, they just assign me the patient, and there seems to be an intention to just derail me from the team, just to derail me from the continuation of the information. So I have to start from scratch. And I see this patient with the amputations. And what is going on here? Because it's one toe, there's another toe, and then we are failing to do our duty, which is to protect the integrity of the body for this patient. And then the surgeon comes and asks for some signed consent, and the patient signs, and again gets another amputation, and this is totally, and it's a flagrant violation of the medical ethics, because we are not giving the benefit of the doubt to protect that patient. The situation is worse because then the patient is obviously not just is exposed to this, but exposed to medication. And this medication, for example, opioids, her in a status of coma. So sometimes I arrive and see the patient in total coma with shortness of breath, with the evidence of respiratory distress. And what are we going to do? We jump into the intubation? No. Immediately when I review the chart, realize that this is a coma induced by medication, by this toxic level of opioids. So put the naloxone, the patient revives, and then people in the background realize that they were thinking that I am like a kind of actor of some sort, and they realize that it's not an actor. But then we have... the situation is repeated over and over and over, and it's like very, very low pace and very disrespectful joke against the patients and against the doctors that are doing the job. Now, the situation, I heard that they put an investment of about $5 million to install cameras inside the hospital without the consent of the doctor, without the consent of the patients, without the consent of all the medical personnel there, totally disrespectful, totally American laws. And this is what happened. They, at the same time, is exposing the patients to all these sort of circumstances. The key factor is that this is year 2002, the postmath of terrorist air attack, and the key factor is that these patients and the president is promoting compassion on a national level. So what else is there? Well, you see, for example, patients that are restrained into 4 points, and I asked to just remove the restraint, give the patient the benefit of the doubt. But then when I go out, then the patient gets back into restraining again, and then at some point the patient are not just restrained, but also get a pneumonia as a consequence of this inability to move the secretions. And that is not enough. Then the patient is exposed to a number of drugs that are producing sedation, and some of these patients die. Now, let's talk a little bit about cancer. I was exposed to a number of patients with cancer. And the cancer, of course, can be or not the diagnosis is going to be done at the pathology level by doing the biopsy and by checking the exams. But in medicine, we have something which is the basic clinical exam. The minute that we waste talking to the patient is 1 hour, is 1 year of gain in the communication, is a year gain in the rapport and in the quality of services. We have to get the information from the patient. Now, these patients didn't have asthenia, anorexia, weight loss. So, I mean, they have no lack of energy. They were eating fine. They were not having significant weight loss. Some of these patients. I remember a patient, for example, from India that was diagnosed with the pancreas cancer. And she was eating perfectly well. When I talked to her, then she realized in many ways, she's okay. So I would go and say, let's give the benefit of the doubt and explore another choice, which is an infection. But that's not what is done. Immediately they jump into the diagnosis of cancer, radiation, chemotherapy, and the patient gets immunosuppressed, and then the patient dies. And this is the kind of situation we are being exposed there. So some of these circumstances, I believe, it can be easily fixed. Now, let's go with the topic of cancer again. Some of the actions will be including, for example, doing the Nacer and acid fat stain, and detecting possibilities of tuberculosis, either Mycobacterium avium intracellular, Mycobacterium marinum. They are sometimes in certain prominence in the community and produce granulomatous lesions that sometimes can be fused with a granulomatous lesions of a metastatic cancer. Because at the end, because who knows the whole truth? We can only know the whole truth once we do the autopsies. But this is what's going on. We are not doing autopsies. A patient is having exposure to vomits, and then the patient died the next day. Ladies and gentlemen, we had to rule out a belladonna intoxication. So this is the kind of situation that we are doing not even one single autopsy, not one single anatomy pathology review of our case as a tool to improve the peer review, the communication among doctors, the quality of the services, and also the cost, because it all goes with fraud. We invest twice what every other nation in the world invested, and this is the situation I am exposed. No wonder you say, this doctor doesn't find a job anywhere. Well, it's all politics. It goes to the politic issue, but it's beyond that. It also goes with the realities of the cost, the money issue. There is a big bias. The motive in this case is money. And if you do not believe me, well, of course, let's go and review what we have, because we have open records today, very easy to verify. Go to a place called Spokeo.com, and we're going to review the names of the doctors, and we're going to review what is going on. I suspect this place gives us a tremendous discovery tool. I review the names of all of the doctors working with me. I review my own name, and let me just share what happened. For example, Dr. Mondul, he was, when you check Dr. Abdul Mondul, you're going to see a number of properties. I think it's 3 or 4 properties. So they have things. The number of people have similar different social security, and the number of properties assigned with that doctor. So Dr. Garg, for example, only 1, 2 properties. Dr. Dimitrov, only 3, 4, 5 properties. And then you have Dr. Anita Soni, who is the the director. She has like 16 properties. This is okay. We can have people with similar names. But this is what's going on. What really is going on is people getting we're talking about politicians, we're talking about supposed leaders, American leaders, we're talking even probably senators, doing this mechanism that is a mechanism for slavery. The mechanism works like this. They get a name of a person, they fabricate the social security number because they have the connection and the power and the relationship with the agencies. With this social security number, they open a bank account, they get a property, and the property serves as a cash cow to finance re-elections and to finance also of unethical situations like this that I am describing here. It goes with many of the problems that we have. It goes, this kind of mechanism, it's used to sponsor sort of nonsense. It goes with, in my opinion, is one of the sources of potential terrorism. we could have terrorism outside, but the worst would be the inside terrorism. And we have to actually protect American lives and protect the nation. And this is something we have to simply go and, as a discovery process, check that nobody's doing this sort of things. Now, when I moved from the hospital, the only choice I had, because I am exposed to all sort of this nonsense, and the president is promoting compassion. There is a mechanism of laundering money. They put these old cameras with the clear intention of broadcasting this over in the internet to entertain the children, supposedly something that we call the children. It's a mechanism of agencies. We have to make money. And this is another topic, doing all sort of scripts and musical things like that. This is a topic for another discussion. But this mechanism then is used to foster inequality and destroy the civil foundation, the rights foundation. It's going back to 1968. In my opinion, 1968, the civil movement was disintegrated in part by using this nonsense of people financing people that can never be traced because are using their their own names, and they are evading taxes and using this source of financing, so-called, to create inequalities and fraud and lies. And we have to stop that nonsense. So basically, for example, Ernesto Garcia is the person I approached to get a rental place when my wife got a delivery. We have to move from New York, came to New Jersey. Ernesto Garcia, how many properties do you think he has? It appears this name appears with more than 5,000 properties. Now you can see the difference. So doctors that make $200,000, $300,000, or more than $100,000 are getting 2-3 names. This person doesn't have any legal, or I should say, this is not the word, do not have a proven income that justifies suddenly 5,000 properties. So bring me the birth certificate of all this Ernesto Garcia, and let's see where is this money coming from. This is a laundering mechanism from international resources being used to create a name of a person that then foster, in my opinion, all this inequality. The only thing we have to do is to go to the Lincoln Hospital, subpoena the financial records, see how many of these donations from weird names or for different names, who this person are, and if we cannot trace it, then we know that it's a real problem. It's a problem of fraud. It's a problem of identity theft going on, and in my case, it's being used by people that are hidden in anonymous power to restrain my access and my capacity to serve the American people. So, by the way, you share my own name, Maximo Gomez. It's the name I used before I became a citizen. When I became a citizen, I incorporated my mother's last name, Maximo Gomez Nacer. But Maximo Gomez appeared with more than 500 properties in more than 23 states of the United States. The last time I checked, it was even hotels in Miami, 5-star hotels, and this is totally a nonsense situation. So if you're nonsense situation because I am homeless, the reality have been homeless and exposed to this agency mechanism for more than 5 years. Totally incredible that these situations are happening in America today. So I need a remediation. The remediation is simple. I want to go back to my profession where I can serve people. I need to have ways to support my 2 daughters, and this is going on. So thank you for your attention, and I hope that we can work together. I don't claim to be the director of any of those programs. It's simply just a medical doctor that wants to serve and go back into his position and his capacity to serve other people. Thank you very much, and have a wonderful day.